Hello, I'm a dentist, Marina Spiridonova. We all want to have healthy, beautiful and clean teeth. And once a year we go to the dentist to have professional cleaning. But 2 or 3 months later, interdental spaces get filled with plaque again, and in a year cavities are formed. Let's have it out. The patient comes to the dentist, and at first glance there is nothing unusual. But after covering teeth with iodine, we see that the picture has changed. All the interdental spaces are packed with plaque, which can result into caries in that area, as well as tartar and inflammation of the gum on teeth of the lower jaw. And now some words about tooth enamel. Tooth enamel is the outer layer of the tooth and contains fluorine, which is very hard material. Its hardness is second to diamond only. That's why the top layer of the tooth is also very hard, but at the same time it's very thin. The plaque is formed on teeth every day. It is made up mostly of bacteria which eat, digest and metabolize their food and excrete the waste products. And the final product of their life is the acid, which dissolves and demineralizes tooth surface. That's why gum line is the best place where tiny and barely noticeable cavities are formed. If in this case we use fluorine-containing toothpastes, gels and rinses, the fluorine will harden the enamel on the edges of the cavity, and so we can damage our teeth, and it would be very difficult to identify caries. Thus, our teeth won't live long. How to eliminate this plaque? You can go to the dentist to do professional cleaning or brush your teeth with ionic or ultrasonic toothbrush. But I offer you to remove this plaque with baking soda. Some words about soda. No doubt, soda is an abrasive and alkali, but only this substance can dissolve the acid ruining our teeth. Any toothpaste contains alkali, but not enough to neutralize such quantity of plaque and acid. Let's see how it works. Take a toothbrush, wet it, shake it, and dip into baking soda, and force the front edge of the brush deep between teeth. Yes, I mean interdental spaces. This technique helps to clean all teeth without damaging them. Brush the inside surface using the same principle. Please mind, you brush only interdental spaces, and again interdental spaces. Clean thoroughly behind the aged teeth, as a lot of plaque is accumulated here. And do not forget to remove the plaque in that area as well. Do not afraid to damage the enamel. Clean gently all interdental spaces with soda. Believe me, the plaque will cause more harm than brushing with soda. Such whitening of teeth can be done at home once a month or less frequently, but it is better to avoid this procedure if you have worn away enamel in the gum margin or hypersensitivity. But one whitening and teeth-preserving procedure will not help to save our teeth. To preserve them, we must brush our teeth properly every day. I have been trying to find the most proper toothbrush for many years. Most of the toothbrushes often traumatized the gums, had uncomfortable handle and were hard. Today, I would like to introduce you Curaprox Ultra Soft Toothbrush, which is really a super brush. I've never seen in my practice a perfect and suitable toothbrush for everybody. Why Curaprox, you ask me? This toothbrush has 5,460 ultra-fine bristles, and this is the only brush that can reach deep between teeth. The head of this toothbrush is small, and it allows reaching the areas behind wisdom teeth. And what's the most important, the bristles are so soft that it allows us to clean the teeth and gently massage the gums at the same time. Nowadays there are several traditional toothbrushing methods implicating sweeping, rotary, scrubbing and up and down motions over the upper and lower teeth. But all of them are relatively ineffective in cleaning the areas between teeth because the bristles do not reach there. That's why I'd like to introduce you a completely new toothbrushing method. Completely new, believe me. So the brush is positioned on the surface of the tooth and slowly moved down to the gum's margin. Here the most of plaque is accumulated. Look how perfectly the bristles are reaching between teeth. Then the bristles are gently pressed to enter the interdental spaces, and then vibratory and pulsing like a drill actions are produced, and it allows the bristles to enter the interdental spaces. As you can see, the brush is positioned practically on gum line. We do not traumatize the gums, but remove plaque, and what's more, the bristles enter between the teeth as deep as possible. Only this toothbrush can clean the area behind wisdom teeth as well as gum line thoroughly. Use this same principle to clean inner tooth surfaces. I would like to draw your attention to inner tooth surfaces of the lower front teeth, where plaque as well as smoker's plaque and tartar are formed. And we always fail to remove plaque from that area. And now, I would like to introduce you a quite different method of brushing of the inner tooth surfaces of the lower front teeth. Most of us clean this area using the front half of the brush. You probably do like this or this. But to clean this area thoroughly, we need to tilt the brush almost vertically. But it is practically impossible. And you may brush this area using different motions, but the front half of the brush will not clean this area properly. So you won't remove the plaque, and then it will turn into tartar. And if you hold the brush like this and try to clean this area, you will find out that it is not so comfortable to hold the brush in this position for some time. So you will manage to clean only the upper surface of the tooth, but fail to clean the gum line. So look, place the back half of the brush on the inner surface of the lower front teeth and move it down to the gum line. This is the area where we should clean thoroughly. Then with vibratory and pulsing like a drill actions, you gently massage the gums and clean teeth. Please mind that you produce only up and down motions, avoid back and forth motions. Look, such motions are wrong because in this case the bristles are positioned at the wrong angle and do not brush between the teeth. My method requires only up and down motions, no back and forth motions. I would like to repeat again. Place the brush here, then with vibratory and pulsing like a drill actions you gently massage the gums. The brush is moved in several up and down motions so that the bristles reach the interdental spaces. I would stress that the ends of the bristles work hard to clean this area perfectly. The common mistake is that very often the toothbrush is positioned at wrong angle, and the bristles being in the wrong position and moved back and forth will clean nothing. I think that Curaprox toothbrush with the ultra-fine bristles is a unique and innovative instrument that guarantees all-around perfect oral hygiene. Thank you, and thank you for your time.